You've heard of private Medicare, and it kind of sounds scary because you're giving up your government's Medicare. And this is your government's Medicare, your red, white, and blue card. And you're not giving up anything. The government, Medicare, is still in charge of the private insurance companies. Private Medicare is called many different things. And you're most commonly known as Medicare Advantage, PPOs, HMOs, private fee-for-service plans, cost plans. And it's what you see on TV all the time. That's private Medicare. You'll be getting your government Medicare, all the benefits that it's guaranteed by the government. You are guaranteed to get all the same benefits. It's not stripped down in any way. You're just getting them administered by a private company. You'll be not using your red, white, and blue card. You will not show that to the doctor's office. You will show your private insurance card from whatever private company that you're using. So here's a list of a bunch of them. WellCare, Blue Cross Blue Shield, Aetna, AARP, Care First, Humana, Cigna, on and on and on. Those are companies that might offer a Medicare supplement plan, which supplements original Medicare, the government's Medicare. Those companies typically also offer private Medicare. So Medicare Advantage, Medicare Supplement, two different ways to handle your Medicare needs. Private Medicare has to have the same baseline benefits, so it can't have anything less. How you pay for it is different. So if you have a Medicare Advantage plan with Humana, they might say a doctor visit costs $10, but your plan with WellCare might be $20. Your plan with Cigna might be $30. So they can all charge different. And that's one of the things that we do here at the Medicare Family. If you go to our website, themedicarefamily.com, and you need an appointment for a consultation, click on the yellow box. And what we do is we research all the plans that are available in your area and try to help you figure out what plan best suits your needs, your private Medicare plan. And it might be based on which plan covers your doctors or the hospital you want to go to, or covers your drugs at the lowest cost, or has the extra benefits. The extra benefits are a very big driver in people choosing Medicare Advantage over the government's Medicare. Because like I said, the government's Medicare, what you get here in private Medicare, it has to be just as good. It cannot be worse. You're not giving up anything. And they have to have something extra that you wouldn't get in original Medicare from the government. So you'll have some extra benefits. Typically, you see some dental, vision, hearing, transportation, meal cards, flex cards, over-the-counter benefits, on and on and on. It varies by company. And just because you saw an ad on TV doesn't mean there's any plans in your county that offer that benefit. And the benefits change every year. So your sister might have had a plan last year that offered dental implants, and this year there's nobody in that county that's offering a private Medicare plan with dental implants. It does change year to year. So private Medicare is the same benefits with something extra administered by a private insurance company. When you go to the doctor, all of your claims, all of them are going to be paid by the private insurance company. That's why you're not giving them your red, white, and blue Medicare card. A lot of people mess this up and they just open their wallet and they give them all their cards. Well, then if they gave their Medicare card, it's going to be declined. They're going to get a letter back saying no coverage because they're not paying any of your claims. It's all being paid by your Medicare Advantage company. Another word for Medicare Advantage, private Medicare, is Part C. So Medicare, we have Medicare Part A, everything in the hospital. Part B, everything outside of the hospital. Part C is private Medicare. And Part D, drug coverage. Most private Medicare plans also have drug coverage. That's why we call them MAPDs, Medicare Advantage and Part D. Again, what's available for you is dependent on your zip code, on your county. Why do they do that? Because they file a plan based on the cost of doctors and hospitals in your county and how much people are using their Medicare. They have all that data. The insurance companies are for profit, so they file plans based on where they feel like they can make the most money. They might have a great plan in your county. They might have nothing in the county next door. And that really confuses people. You just got to remember this is for profit. They're for profit companies, and they're filing where they think they can maximize their profit. And again, this does change from year to year. So if you're curious about what private Medicare plans, what Part C Medicare Advantage plans are available in your area, go to the MedicareFamily.com. Top right-hand corner, the yellow box. Schedule your own appointment. You don't pay extra to work with the Medicare Family. A team member will reach out to you when you find it convenient. Tell them when to call you, and they will tell you what's available and explain to you, if you're looking for a specific benefit, what plan might offer that, and try to guide you through the very confusing offerings that are private Medicare. You might have dozens and dozens of options to wade through, and it's not as easy as just saying, well, my sister likes Blue Cross, I want Blue Cross, or I want the one that gives me dental. There's a lot more that goes into it. Let our experts at the Medicare Family help you figure this out. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.